I'm really excited to talk about this topic as a physical therapist who is a mind-body physical therapist that cares about how the brain and our body works, especially when it comes to chronic pain. So what we're going to talk about are things that I noticed as a mind-body physical therapist, especially when it comes to movement behavior. So I'm going to talk about top 3 common patterns that I see. But first, let's start with the story. All right, so let's talk about how chronic pain can show up in movement. So I want to first start with the story. I am really fascinated by movement. I really enjoy talking about movement and understanding about movement. And as a former tennis player, I love understanding how body mechanics move, how we can utilize the things that's inside our body that helps us create not only efficient movement, but just strength or potentially help with pain. So if you see Roger Federer, when I was a tennis player, Roger Federer was just going on to this peak and such a beautiful tennis player. So this is something that I think about and talk about, and how I could help people, not just when it comes to efficiency movement, but pain. And I want to share this story because this relates to how I came about with chronic pain. So I studied. I went to courses, bunch of courses, tons of continuing education courses. If you're a physical therapist, it's really about what you do after becoming a physical therapist is such a big thing. So I've done many, many courses, and I've taught courses as well. And there's one thing that I noticed within our industry when it comes to learning these continuing education is depending on what institute, especially a focus they have, there was this common theme of, they would say, intentional or unintentionally, this movement is bad for this diagnosis or this movement. So what eventually happened was, hey, bending your back is bad. Then if you go to different institutes or different continuing education courses, they would say, hey, this movement is good for your back. And as a physical therapist who's learning, this eventually becomes really, really confusing. In the beginning, it seems very helpful because when we start to understand the human body and even just the body itself, it's so complicated. Having this guidance of, hey, this is good, this is bad, is something we've learned in our system, our school system, probably in our culture, etc. So this became a very good thing. Now, what I realized here at a certain point is we all have a tendency to put meaning to these words, to these movements, to these feelings. And this is such an important thing for me to start considering because I understood, even in the physical therapy world, some continuing education or subset of group will say extending back is bad, and subset would say this is good. And depending on how we see and how we look at movement, this will greatly influence who and how we are when it comes to movement. So just wanted to share you this story here because if you become really confused as a patient who is getting treated by a physical therapist or anyone, and you're starting to get confused because there's this thing that happens, I want you to first know you are not alone. And my goal with this video here is to just give you this perspective a little bit and see how this relates to a person that has gone through a chronic, suffering through chronic pain in general. So these are 3 common things I see as a mind-body physical therapist with chronic pain, especially when it comes to movement. So the first thing is avoiding movement. And when I say avoiding movement in this particular case is not necessarily avoiding movement when you have an acute injury or where you have a huge flare-up. That's not a bad thing to do. But when the injury has long been healed, so let's say you have an ankle sprain that's 2 years old, right? There's a very good chance your ligament to the tissues are healed in the way that it could right now. or an ACL injury. Like 2-3 years later, it has gone through pretty much the tissue healing process that it needs to happen. What happens is, because the chronic pain, the pain has like created this neural pathway, it starts to create and connect to different set of rules in our brain. So they start to avoid movement in general or specifically. So for example, let's say if you have a knee injury and you stopped avoiding squats in general because it's scary. Now, the important thing to recognize here is, what is the real fear for the person? And you start to investigate that, become curious about that. Because some people are scared of the feeling they experience, or they strongly believe that when they do squat, they are damaging the knee or anything else. Or some people, they do believe that their knee is no longer injured, but unconsciously they avoid certain subtle movements in that particular body part that could, they have this connection to pain. A great example for me is when a person goes, I can't bend over right now, and unless I had a perfectly straight spine, my back will break. And that is far from the truth, what we know with evidence. So just giving themselves this different understanding about pain is a crucial thing. But they start to avoid this particular movement in particular body parts sometimes, or overall. So just starting to learn how to weave, getting out of the weeds a little bit, and communicating about what is their fear is a big step for these individuals. The second common thing that I see is pushing through. So it's not uncommon to see people that are very high achieving perfectionists when it comes to people that suffers through chronic pain. So what they do is like, hey, I'm not scared, I'm going to push through. And what this often does is they avoid a particular feeling that they are kind of trying to push through. So what happens is they create more disconnect. And what happens is they're doing it from a place of so much pressure. And it creates so much pressure in them in the sense that our system stays always in this hypervigilant state. Like they can't relax. And pain is a danger signal that our brain says, hey, this is something dangerous to us. So this is a common thing that leads us to continue to have pain and just kind of have this behavior that doesn't help us in the long term. And lastly, number 3 is the individual starts to create rules. So if you're like me, you probably, and I share this with you just to help us kind of connect to this. As a physical therapist, when you start to recognize all these things about the body, if it comes from a place of protection and fear for ourselves, which is very common in our system, we start to have rules. So I would say, if I don't feel my back muscles, I am screwed. Or if I don't feel my hamstrings or groin, I don't feel safe. So we start to create these rules about these things. So what happens is we're trying to avoid something versus, hey, I do this because it feels good for me. I do this because I like it. These are things that starts to push us into a more and more cornered place, which doesn't help us in the long term. So I hope that was helpful, guys, for those that are watching. And if you are interested, check our newsletter. Sign up for the newsletter. What I do is share you the things that I go through on a weekly basis to help you kind of see the ins and outs of what chronic pain is and how it works. Along with that, you will get exclusive offers with breath work, etc. So sign up. And if this work resonates with you, kind of sign up for a discovery call. There should be a link down there.